All right, so we are super excited to have Paula here to talk about speech and language with everybody. Paula, I'm going to let you start off by introducing yourself and taking us through today's education. Thank you so much for being here.
Great. Thank you so much. So my name's Paula Johnson. I am a speech language pathologist, speech therapist. It's the same thing. I have, over the course of my career, worked in just about every setting that is available. I've worked in grade school and high school and junior high and hospital and pediatric hospital, NICU. Every setting, nursing home. But my first love and my longest love is pediatric therapy, and specifically, I love working with the little tiny people. They are my absolute favorites. I always say I'm glad I don't have any toddlers living in my house anymore, but I do love working with them. So what I wanted to talk about tonight is just a little bit about speech therapy and and how you can know if you might need to seek services for a young child that is in your care, or a child of a family member or a friend that you know that maybe you see some things that concern you. We're going to go through tonight. First, I'm just going to do a quick review of speech and language milestones for over the first 3 years. It's always amazing to me how much progress kids make in those first 3 years if everything is going as it should. We'll also talk about what to do if a child isn't meeting their milestones. What are some steps that you can take? And then a little at the end about what speech therapy looks like with toddlers and 2-year-olds. An awful lot of people had speech therapy themselves when they were in school, work on their S sound or their R sound. And if that's their vantage point for what speech therapy looks like, it's hard to imagine what we do with an 18-month-old or a 2-year-old in speech therapy. And it's definitely very different. So, and then as Sharice mentioned, there'll be time at the end for questions, but if you have a question and you're afraid you'll forget it before we get to the end, feel free to just break in and ask a question. It's just fine. Okay, so starting with milestones, and it's amazing to me, and I never stop being amazed by the fact that speech and language starts developing even in utero. They know now that from the third trimester on, even the late second trimester, that the babies are starting to hear sounds from in utero, and they're hearing the voices of people around them. If you've ever seen any of those videos where a newborn is crying, as newborns tend to do, and then they hear their mom start to talk, and they get still, and it's because that's the voice that they've been listening to for months, and they recognize their mom's voice right from the start. So it's just remarkable to me that we start developing these skills before we're even on the outside. So from a brand newborn to 3 months, so that's those first 3 months where, I always called my kids lima beans at that point. They don't really do a whole lot, but they're still learning skills even from early on. A newborn, they're going to alert to sounds. They're going to get quiet when you talk, or start to see some of those kind of reflexive smiles. So they're not necessarily the eye contact and looking at you in the light up face, but you'll start to see a child who's kind of half asleep and their little lips go into a smile. They will start even very young, usually closer to 3 months rather than freshly newborn, start to make sounds just back and forth. Uh, every parent knows we can hear those different sounds even in a very young baby. We know when our baby is making contented sounds versus unhappy sounds versus sounds of being in pain or sounds of being hungry. We can hear those differences from very early on. Start to hear those coo sounds, the kind of ooh that is not like an adult ooh, but it's just a baby ooh. It's cooing and gooing is what we call that. Those really adorable early sounds. Even again, from very early on, babies are going to recognize the voices of people that they hear a lot. So we always say, talk to babies right from the start. Talk to them, read them books, sing them songs. They don't have to know what you're saying to start hearing the rhythm of language and hearing the voices of the people that are around them. And babies will often turn or look toward voices at this age. Then 4 to 6 months, and I've always said 4 months is that point where you're tired, and if you don't start getting some payback from this baby, you're going to kind of start to lose it. 4 months is right when we start seeing those social smiles and those real laughs and giggles. I swear with each of my kids, by 4 months, I was about ready to throw in the towel. I was tired. But that's right when Mother Nature knew we needed to start seeing some smiles and some real social interaction at that point. So from 4 to 6 months, we start seeing that giggling and laughing. Babies will respond to facial expressions, and you'll see their facial expression change when the adult who's talking to them has a big happy smile versus if they're furrowed or sad. And you will see the babies starting to reflect those feelings even at this young age. They start to be able to look at objects and follow objects with their eyes, start reacting to those toys that make sounds, those cause and effect toys. You hit a button and something lights up or makes a sound. Sometimes they react with joy, sometimes they react with fear, sometimes they have to get used to those toys, but you'll start seeing more of that interaction with the environment. This is when babies start to vocalize during play. If you've ever watched a little one, maybe in one of the, like in a bouncy seat that's got the toys above it, and maybe there's something that makes lights or music, and you'll start to see them talking to the little fish on their aquarium, or start to see them talking to the toys in the crib. This is also when you start to hear some different vowel sounds and some more well-formed vowel sounds. Still not a lot of that babbling just yet. 4 to 6 months is also usually when we start hearing babies starting to make a lot of sounds with their mouth, blowing raspberries and just making fun sounds with their mouth, realizing they can do more with their mouth than just eat and cry. Now, 7 to 9 months is where we really start to see a lot of changes. And this is about when it's not on the PowerPoint, but this is right about the time when we really start to see that joint attention kick in. Joint attention is basically a triangle of attention. If you think about, you've got a little person and an adult, and then something that the little person is interested in. And it might be a dog walking by outside, it might be a toy, it might be a TV show, it might be another person. And I'm sure you've all seen this situation where a child sees something and then they turn to look at an adult, and they're looking to see if you're seeing it too. You know, they want to know, are you looking at what I'm looking at? Are you seeing this? This is, this is amazing, or this is kind of scary. I'm not sure what to think about this situation. That social joint attention starts to show up right around this time. That is often one of our first signs that a child is struggling with early communication milestones, when you have a child in this 6 to 12 month stage who is not necessarily looking to the adults around them to get their reactions to things in the environment. So 7 to 9 month old is going to start looking at you when you say their name, not consistently, not 100% of the time. That's something really important with these milestones, is to recognize that a milestone, when a child hits a milestone, it doesn't mean they're doing something all the time or something very consistently. You start to see them appear and they become more consistent over time. They'll look at you when you call their name. It's one of the reasons I recommend that we all love to have nicknames for the children that we are caring for, but I would definitely recommend not having 15 different names that you call your little baby. You know, if you call him Chunky Monkey and Chunker and Monkey and Munker, and, and their real name and their nickname and their name and their middle name, you're going to see a lot less of them paying attention when you call their name, because they're not necessarily going to know you mean them. Stops for a moment when you say no. And it doesn't feel like we should be telling children no at this age, but this is also the age where kids are starting to get a little mobile and might start getting into things that we don't want them to get into. And there's no expectation that they're going to listen 100% of the time, but this is the age, even this young, where they start to get into something and you say in that firm voice, you say no, and they'll pause, like, wait a minute, what just happened? This is when we really start to hear those strings of sounds being babbled, the mum, 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 da, 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 da. Typically, most kids will start with M, B, D, and N. Those are typically the first consonant sounds we'll hear, but some kids like the L sound, and they la, 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 la. Every kid is different. Around this age is when we start really looking for somebody that we know loves us when we're upset. And we'll look around. This is the age when you think about a newborn, and if a newborn is a little fussy, just about anybody can pick them up and comfort them, and they're gonna be comforted. This is the age where I don't want random aunt that I've never met before to pick me up for comfort. I want somebody that I know and trust to pick me up for comfort. This is when kids will start to make gestures in exchange in response to what we say to them. So this is about the age where we say, "You want up?" Where they'll start to lift their arms up to show you, yes, that's what I want. I want to be raised, well, lifted up. Or we start to say, you say bye bye, and might start seeing that raising of the hand. This is about the age too where kids start to recognize the names of some of their favorite, very, very favorite people and things. Usually family names, mama, dada, grandma, Gigi, whatever you're calling them, or pets are often the first thing. So you'll say something about the dog, and you'll see the baby look for the dog or look at the dog because they're already starting to recognize what words mean and that words have meaning. And kids at this age are starting to develop preferences, and kids develop their preferences for people and objects very, very young. And this is the age where they will start, nah, I don't want that. I don't want that, food. I don't want that toy. I don't want you to do that. You'll start seeing that even this young. Okay, from 10 to 12 months, this is when little ones will start reaching for objects. A lot of kids are starting to get mobile in this time. Just as a side note, the range for walking, some kids will walk at 9 months. Other children won't walk until they're 16 or 17 months. My physical therapist friends tell me that anything up to 18 months is still considered within normal limits for walking. I always like to make sure that families understand that walking tends to come before talking, unless there is a physical reason that a child has difficulty with walking early on. Late walkers tend to be late talkers, and that's just something to kind of tuck in the back of your mind. The 10 to 12 months, we reach for objects. This is when we're starting to point. We point to show other people things. We point to things we want. We point to things that are interesting. Pointing often starts with a whole hand, almost looks like more of a reach, and we kind of refine that single finger point over this time. This is about when kids will start to wave hi and wave bye, and then showing and giving objects. So this is where a lot of children are starting to show interest in, what are these things called? This is where kids they'll pick something up and they'll hold it up to an adult and kind of look at the object and look at the adult. And it's almost like they're asking a question. They're looking at it like, what is this? What is this called? What does this do? Is this something I can have? So it's never too early to start labeling everything in the environment and telling them what things do, what they're for. This is when kids will start to imitate and initiate gestures for, we call social games or people play, blowing kisses, playing peekaboo, is a crowd favorite. How big is baby? So big. Patty cake, things like that. When we play those kinds of games with kids, they will start doing things like putting their hands up to their eyes to show you that they want to play peekaboo, or maybe putting a blanket on your head to show you that they want to play peekaboo. This is about when kids will start to try to copy sounds you make. Now, they're not necessarily going to always copy words, and they're not necessarily going to be able to sound the way that you do, but it's when they're going to start trying some of that and start making a wider variety of sounds typically. Kids at this age love dancing. Specifically, that's a question we always ask, whether kids dance to music with a beat. That seems to come in with language understanding, is kind of understanding rhythm and understanding that we move our body to rhythm and to communicate. This is also when kids start being able to respond to simple words and phrases and very simple directions. This is about the time where you're going to start to be able to say, like, oh, it's time to eat, let's go eat. And they'll start to head to the kitchen, or you say it's time for bath, and they'll start to head to the bathroom or get excited or whatever. You're starting to realize at this point that they're definitely starting to pick up a lot of simple concepts. A lot of kids at this age are starting to say a couple of words. And again, typically it's those words that either have a lot of meaning and power for them, or the words they just hear a lot. So we do a lot of hi, bye. So those are often among kids' first words. Mama and dada are often among the first words. And if your mama and dada is the first word or vice versa, don't be worried. Don't be sad. It doesn't mean that they love one of you more than the other. It probably just means that your child finds the M sound easier than the D sound or vice versa. So it's not personal. Okay, now 13 to 18 months, this is where we typically will really start seeing some expressive language. And we divide language. We have receptive language and expressive language. Receptive language is what a child can understand, and expressive language is what they are communicating. And expressive language, we usually use that to mean talking, but it also signing, gesturing, all of that is expressive, and it's and intentional communication. 13 to 18 months is typically where we really start seeing the verbal expression coming out, and start seeing understanding really getting strong. So this is the time period where kids are starting to understand simple where questions. Where's daddy? Where's the ball? Where's the cat? And you'll see them look around, and maybe point to answer your questions. So they're starting to understand some of those very simple questions. Again, we can follow those simple directions. Give that to me. Get your shoes. Now, are we always going to do it? No, because we're toddlers, and toddlers do not always follow directions. That can be one of the challenges sometimes, is figuring out, is my child not following directions because they don't understand it? Or are they not following directions because they're a toddler? And sometimes toddlers don't understand the directions. We'll talk a little bit more about that in a bit. This is the time where kids really start to use pointing more communicatively. So early on, when they're first starting to point, they'll point to just kind of show you things like, look at that, look at this picture in the book, look at this, see that dog over there? This is the age, that 13 to 18 month period, is when kids will point like to a snack. This is where you start being able to go to the snack cabinet and open it up and say, what do you want? And they can point at the snack that they want, or point at the cup they want to use, point at the shirt they want to wear, because toddlers are very opinionated little people. The point to question, that usually is going to go along with that facial expression where they look back at you like, what is this? Tell me more about this. This is the age where some kids will start to shake their head for no and nod their head for yes. I'd like to state very clearly that some kids don't do that, and I don't know why. Some kids, they get the shake first. I think the shake is easier. The word no is easier than the word yes. So we often have a lot of no before we get any yes. We don't worry about that particularly, but if you're finding that you're with a toddler who's doing a lot of, oh, do you want some juice? And then they get upset when you don't hand them juice. That's where you can start modeling, yes, I want juice, with a nice big head nod. 13 to 18 months is where we start really understanding and starting to say words for our very favorite people and things. And again, it's usually the things that have the most power for young children are going to be the first words that they say and the first words they understand. So words for their favorite people, words for their pets, words for their siblings. This is where we might not be able to say their full name, but maybe this is where we start hearing Bubba. No and mine are two words that often appear during this time because they are very, very powerful words. Sometimes parents don't love hearing those words come out. I personally prefer the words to, if we don't have the words, we usually use our body in some other way to express no or mine. And I would rather hear the words than, have the physical expression of no. A lot of kids at this age will identify one or more body parts. And I want to be real clear that means, like, if you say, where's your nose, that they can point to their nose. That doesn't mean, what's this? And then they can say nose. So when we're identifying things, it's more that they can identify it. And some kids will point to it on themselves. Some kids will point to it on you or another person. Some kids like to point to it on a doll or on a bear or something. I love the song Head, Shoulders, Knees, and Toes for that. It's a really fun way to introduce all of those body and face parts. Um, so, but this is when it comes out. This is also often when kids start to use a lot of what we call jargon, which is if you think about any young toddler you've been around and they're jabbering away. And this is where you hear a lot of people describe it as, oh, he's jibber jabbering or he's talking in his own language. Or what a lot of kids are doing at that age is they've been hearing the adults around them talk. They hear what our language sounds like, but they don't have enough words to talk the way we do. So what they're going to do is string together the sounds they do have, and they're going to give it intonation. We call it jargon with sentence-like intonation. And then if they have some real words, they might stick an occasional actual word in there. So you might hear like, and that you hear a lot of that at this age. And sometimes families get concerned at this point that, oh my gosh, he's not speaking clearly. Again, we'll talk a little bit about that later. And this is where kids are going to really start using a lot of those like social gestures, like clapping for applause, clapping for themselves when they're proud of themselves for doing something, giving high fives and fist bumps, making funny faces, sticking out our tongue, all that kind of just social ways of using our body. And this stuff doesn't feel like speech and language skills, but it is. It's language and speech are actually two different things. Language is the words that we use, the words that are in our head. And again, like language, we can talk, we can sign, we can use pictures, we can use a communication device. Language is that communication piece, where speech is the physical action of using our mouth and our breathing and our vocal cords to actually string sounds together and create words and phrases and sentences with our mouth. And so speech and language development, speech development is really tied into motor development. If you think about how babies develop, they start with developing the big muscles, those big core muscles. Babies, the first thing they can do is hold up their head, which takes core strength, and rolling over, which takes core strength, and then learning to sit up, which takes core strength and balance. And then we start pulling to stand, using those big muscles in our legs. And then we start reaching for things and using the muscles in our arms, and then grasping things where we're using the muscles in our hands, and then refining that grasp down to that little pincer grasp. Speech, the process of stringing sounds together, is just a very, very, very fine motor skill. So gross motor skills are the big muscle, big body skills, walking and sitting, and running and things like that. Those are gross motor skills. Fine motor skills they're the finer, they're using those smaller muscles. So fine motor skills are putting shapes in a shape sorter, or writing or drawing and coloring. Speech is a very, very fine motor skill. So anytime that we're working on helping kids learn to use their body with intention, we are helping develop the foundational skills that they will need to be able to use their mouth to talk. All right, 19 to 24 months. Now we're really starting to see some serious expressive language growth typically in this age. Now, this 19 to 24 month age is typically, if there are speech and language concerns, sometimes they show up earlier, but this is almost always the age window where the either like the 2-year well visit is when a lot of families end up getting referred for speech evaluation. That's when, that 2-year well visit is when you go in and the pediatrician has some questions about, well, does your child say this many words? Does your child understand these things? And that's where a lot of families go, oh, no, not even close. And that's then when they end up coming to me. Now, just like walking can happen between like 9 months and 17 months and still be typical, this number of words milestone is kind of a scary one. And there are lots of different studies that have been done about vocabulary size, and it is so, so variable. So we say 19 to 24 months. So by 24 months, the bare minimum words that we would want for a child to be understanding and preferably using is at least 50. And I know that sounds like a ton, but if you think about like mama, dada, grandma, and then 2 different siblings' names, a dog and a cat and we have car, bottle, blanket, I'm already to 10, just like that. So 50 isn't as many as it sounds like. Now, one study that I saw said that a typically developing 24-month-old could have up to 400 words in their vocabulary at that point. Now, I don't see many of those kids, but I also work with kids who are a little behind in their speech and language skills typically. So, but we really want at least that 50 words. Now, in that 19 to 24-month window, I'm not going to be so worried about a 19-month-old who does not have 50 words. I'm going to be a little more concerned about a 24-month-old because typically that 50-word threshold is where we start seeing kids putting two words together. Hi, mommy. And if we have fewer than 50 words, then we're still very much at the single word level at 2 years old. And we want to start seeing those phrases coming out. Now, very important to know those 50 words, they may not be clear. They may not sound like adult words. The development of sounds, kids don't develop all the sounds in the English language, and I'm coming from an English perspective, but all of the sounds that are in an adult language, they don't develop all those until an average of age 6, but it's still considered within developmental limits for even like a 7-year-old to maybe have trouble with the R sound or the TH sound. So at 19 to 24 months, we are definitely not expecting total clarity. Like we might still be saying baba for bottle or for blanket, and that's okay. That still counts as a word. If a child says woof every time they see a dog, that is a word. Even if they're not saying the word dog yet, if they're just saying woof, woof, woof and pointing at a dog, and you know that woof, woof means dog to them, or woo, woo means fire truck, that's great. Those count as words when we're talking about kids this age. Again, this is the age where we usually start to see kids putting words together. Usually just 2 words at a time. And very often we're taking a word that we already say and we're adding more or hi or bye or please to it. Those are usually very early 2-word phrases. Kids at this age, we like to be able to see them following 2-step directions, 2-step related directions, I should say. So get your shoes and bring them to me. Go get your blanket and take it to dad. Go find your cup and put it on the table. Again, we're still a toddler. We're not necessarily going to follow all the directions all the time, but we would expect to be seeing that at this age. Kids at this age are starting to use pronouns, starting to refer to themselves and other people. I or me or mine are very often the ones that we start to see first. And it's perfectly normal for kids to say things like me do it. They will not go to college saying me do it. They will figure that out over time. But grammar is complicated. So, but we'll start seeing those pronouns at this point. This is also the time where we start hearing kids using words to ask for help. I mean, they may say help, please, but also like asking for help getting their shoes on, asking for help getting a drink, where they'll start to use more specific vocabulary for that. You know, shoes, mommy. This is also where we'll start to sometimes hear kids starting to use possessives like daddy's shoes, kitty's food. Now, right along with the maybe not so clear speech, you might hear daddy sock, not daddy's sock, because they just might not be making all the sounds yet. But the concept of things belonging to people usually comes out around this time. Okay, now 2 to 3 years. By the time a child is 3, we usually have a pretty healthy sized vocabulary. We're starting to speak in phrases and short sentences, or in some kids' cases, long sentences. The range of typical when we were talking about language is very, very broad. Everybody has known that kid who was speaking in complete sentences when they were 18 months old and then worried when their own child was not doing that at 18 months. That's not typical, but it happens. So from 2 to 3 years, we're starting to use phrases a lot. They may repeat words in those phrases. And I love to talk to families that are around kids this age. You will very often hear kids say something like, I want it. And that's the point where a lot of people get concerned about stuttering. Oh my gosh, is he starting to stutter? Now, obviously, I can't sit here now and say, oh no, no 2-year-old ever stutters, but true stuttering is pretty rare in 2-year-olds. And usually the stuttering has a very strong genetic component to it. So if we have a child where neither parent stuttered, no grandparents stuttered, no older siblings were stutterers, it's unlikely. Something called developmental disfluency is very, very common at this age. And my recommendation is always that we essentially ignore the fact that the child is disfluent. So if you've got a kiddo, because what's happening is really their little brain is just working faster than their mouth can keep up at this age. I mean, their vocabulary is exploding, but they still can't talk in complete full sentences and paragraphs like an adult. And so their little mind is racing and they really want to tell you something, and they get stuck on a word and it comes out over and over. And my recommendation is always we maintain eye contact, we stay very calm, we let them finish their thought, and then we respond just like normal. What I recommend that we do not do is we don't say, stop, slow down, take a breath, try that again. Basically, at this age, with that little bit of disfluency, I don't want kids getting tense about their speech because it can become more problematic if they start to really become aware and anxious around speech. We want kids to feel super comfortable and confident around their new speech and language skills. Of course, if you're concerned about that, I'm going to go into later how to reach out and get an evaluation because obviously I can't, like you said, I can't sit here and say no child this age ever has stuttering, but it's pretty unusual at this age. So kids around this age, we would like them to say their name when asked. They may not do that on their second birthday, but by their third birthday, most kids can answer the question, what's your name? They may not do it if it's a stranger asking, but they know their name. They're starting to use plurals at this age. And so one toy, two toys, one dog, two dogs. We're starting to hear ing and ed verbs coming out. They may not, especially irregular verbs, like you might hear kids say runned instead of ran. You know, I runned over there. And that's okay. What that tells us is that they're understanding how the language works and how the grammar works, and they just haven't figured out all the little exceptions just yet. This is when kids start to ask why and how. Our why phase. Why? Why? Really annoying phase, but also a really fun phase because they're showing such curiosity about how things work and why things. Why do I need an umbrella when it's raining? Why do I need to wear my coat? They're learning about their world and they're learning all the language, but also why? Oh my goodness, stop. Kids at this age can answer questions about the functions of objects. So these are usually questions that come up in our evaluations, like if we've got a pair of shoes and a cup and a ball, and I say, which one goes on your feet? A child should know that it's the shoes that go on their feet. Which one do you play with? What do you drink out of? They start to understand the functions of objects. Now, from 2 to 3, our speech is usually starting to become more clear, but definitely not understood by unfamiliar listeners. So typically at this age, for a typically developing child, immediate family and any like full-time care providers are going to probably understand 90% or more of what a 2 and young 3-year-old child is saying, where grandma may understand 75% and the cashier at Kroger may understand very, very little. Because understanding a 2-year-old a lot of times requires, for one, just familiarity with the errors that kids tend to make. And there are a lot of age appropriate errors. So for example, S blends, we use initial S blends in a lot of words like star, steps, spare, all those words that start with S paired with another consonant sound. Those are hard for very little kids. So they tend to leave out one sound or the other. So you'll hear kids ask for a poon instead of a spoon, or they say they want a knack, not a snack. The adults who are around them a lot understand their language. Adults who are not around them so much may not. But and context is helpful too. But we're starting to really develop those skills by this age. Okay, so what if a child is not meeting milestones? I would say the first thing is, like, don't panic. A lot of kids don't hit all their milestones, and there can be so many reasons for that. And I will talk about some of those in a minute. But I also don't love the wait and see approach. So having kids of my own, and then also working with a lot of families over the years, I know that very often what happens when we talk to our other mom friends, or we talk to grandma, or we talk, we talk to other women, other parents about, gosh, my child's not doing this, and I saw this kid who is. And our first response is very often we want to make people feel better about what's happening. So, oh, that's okay. This child didn't talk until they were 4, and he's going to Harvard now. Or, everybody has that story about a child who talked really, really late and everything is fine. But sometimes there are kids who don't talk until really, really late and everything is not fine. So while I appreciate the impulse to make people feel better, I do not recommend, well, let's just wait and see what happens. Let's give it 6 more months. Let's give it another year. I am not a fan of that particular approach. So we don't want to panic. We don't want to freak out. Just like we always say, like, don't Google your symptoms, because if you Google any symptoms you have, you're totally going to diagnose yourself with some rare form of cancer or something. If you Google speech and language using certain words, you're going to come up with some, my child is a late talker. Oh, your child may have autism. Well, your child very well may not have autism or apraxia of speech, or your child may not have had a stroke. Like, if you Google it, you may get some very scary things. So I don't want to panic, but also I don't like to sit back and wait. In this area, there are waiting lists for every service that's out there, for speech, for physical therapy, for occupational therapy, for feeding therapy. There are waiting lists everywhere. So if you say, well, I'll give it 6 more months, and you give it 6 more months, and then you sit on a waiting list for 6 months, now you're a year behind. And I would rather not have that situation if we can avoid it. So often the first step is going to be the pediatrician. Whenever you have concerns about a child's development, you talk to the doctor, and explain what your concerns are, and they can discuss that and give you some options. But when we're talking about a child under the age of 3, you can also just directly call intervention, call early intervention. Every state has an early intervention program. It's part of IDEA, so it's part of the federal education law. Every state has early intervention. Now, it looks very different from one state to the next. It's one of those federally mandated but state-run programs. So it's always interesting to me to talk to early intervention providers from other states and hear how they do it compared to how we do it. But every state has one for children. It's either birth to 3, and sometimes it's birth to 5. In Illinois, it's birth to 3. And I'll give some contact information for early intervention and talk about that process here in a couple of minutes. So why isn't my child meeting their milestones? And I get that question a lot. Why? Why is this happening? So these are some possible causes, some things that I see a lot. If there are other areas of delay, as I mentioned earlier, late walkers are very often late talkers because our body develops those motor skills from gross motor toward fine motor and then toward more fine motor. So, we start by gripping a crayon with our fist, and then we move to gripping a crayon like this. And pretty soon we work into that nice little tripod grasp for a crayon or a pencil. So if a child is generally delayed in their motor skills, if they were late to sit up, late to crawl, late to walk, they're probably going to be a little bit later to talk too. So it's not unexpected. Motor driven. And by that, I mean, we have all met those children, and not to be stereotypical, but very often a boy. Can be girls, but very often boys. But those toddler and 2-year-old boys who are in constant motion. They like to run and climb and jump, and they're your early walkers. They're your kids who were up and walking at 9 and 10 months, and they just never stop once they go. And it's not that being motor driven stops them from being able to develop those skills, but if you think about, in order for me to talk, I first have to understand words. And in order for me to understand words, I have to slow down enough that the adults around me who know the words can tell me what things are, what things are called. And kids who are in constant motion, and you can almost feel that their little body is buzzy and they have trouble focusing their attention because they just have this need to move and move and move and move. Those kids are often somewhat later talkers because I'm not going to talk if I'm so busy with my body that I am not really paying attention to language just yet. Excuse me. A history of trauma can definitely be a cause of delays in multiple different areas. And of course, when we are talking about kids who are in DCFS care, there is not always, but very often, a history of trauma. And when kids have trauma, their little brains and bodies are working very hard on, if you've seen Maslow's pyramid of the hierarchy of needs, and our most basic need is to feel safe. And when kids are using a lot of their resources focused on safety and basic wants and needs, or trying to recover from a traumatic incident or a string of traumatic incidents or a difficult background, that can delay some of our development. And again, that it's not unexpected. It's not ideal, obviously, but that can definitely be a cause of some being behind in some milestones. Prematurity is a big one. Medical science has come so far, and it's amazing to me that my own children, I have twins who are 22 years old now, but they were born at 26 weeks. It's how I got into this field. And when they were born, the survival rate of 26-week babies was about 85%, where now the survival rate of 26 weekers is very, very, very high. And babies as young as 23 and 22 weeks and almost 22 weeks are able to survive with a lot of medical care. Now that prematurity, the medical care that is often required for a very premature baby is traumatic in itself. A lot of needles and sounds and stuff. But even children who are what we would consider like a late preterm, like a 35-week or 36-week baby, where we're not worried about survivability at that point so much as we are they just weren't quite cooked yet. They just weren't quite yet ready to be out in the world. And that prematurity can affect some of their skills and not other skills. So they just might lag behind in some areas and be perfectly on target in other areas. They might be on target in every area, but children who are premature are at higher risk of speech and language delays. And micro preemies, those little ones under 1,000 grams, I think, is they are at much higher risk for delays in multiple areas. Now, autism is a fairly common cause of speech and language delays, but it is far from being the only cause. And I always say that typically in kids with autism, long before we notice that they're not talking, we'll notice some of those other milestone skills that I talked about earlier, not being present or not being very strong. In particular, that joint attention, that looking at something, checking in with an adult to get their reaction. You very rarely see that in young children now, of course, there are all different levels of autism. So when I say you don't see that often in young children with autism, I'm talking about young children that are more on the moderate to severe to profound autism versus a very mild autism where they might develop looking pretty typical until they hit school age, maybe, or until we start getting into more complex social situations. But that's out of our scope here. Another possible reason for speech and language delays can be Down syndrome or any other chromosomal or genetic condition. Those often come with speech and language delays. A family history of speech and language delays. Uh, there are a couple of particular causes that tend to have a genetic basis. Autism has a genetic basis. Childhood apraxia of speech has a genetic basis. I have a couple of families that I have worked with over the years where they have 4 or 5 children, and I have worked with all of their children as they come along. They hit that 18-month or 2-year-old mark, and I get the call, "Hey, we've got another one for you," and the kids all kind of have the same type of delay. And then hearing loss or a lot of ear infections can be problematic for, I mean, obviously hearing, like a known hearing loss, a child who does not pass their hearing screening is diagnosed with hearing loss early on, is most definitely going to have challenges meeting their speech and language milestones, but also kids who spend their early years with chronic ear infections. We always say that when a child has an active ear infection or just that fluid in their middle ear system, it's kind of equivalent to if you're underwater in the pool and there are people talking to you. Like, you can hear them talking, but you can't hear what they're saying very clearly. And that is what it's like for a child whose middle ear is all full of fluid, is that for that period of time, they're not hearing so clearly. So if out of my first 2 years, I've had 7 ear infections that lasted for 3 weeks each, that's quite a number of weeks that I have not been able to hear clearly. So it's not going to be a surprise if I'm a little bit later to develop speech and language or some certain sounds. And sometimes, and I'll be honest, a lot of the time, there is just no clear cause for whatever reason. I have a little one right now where it's the youngest child with multiple older siblings, and all of the older siblings were early talkers. They were all very highly verbal, very young, and for whatever reason, the littlest one is just struggling to hit those milestones, and sometimes it just happens. Speech and language delays are really common, actually. So things that are unlikely to be the cause. I hear a lot, well, his older brother talks for him all the time. Older sister talks for her all the time. That may be true. And older siblings do love to talk for their younger siblings. However, that is not generally a reason that a toddler isn't going to develop those language skills. I mean, if you think about a typically developing toddler, they want to do everything for themselves. They want to put their shoes on by themselves, even though they don't know which foot they go on. They want to get it themselves. They want to open their own, applesauce pouch. They want to get up at the high chair by themselves. I do it, I do it, I do it. So the likelihood that a toddler is going to allow an older sibling to talk for them and just go, I don't need to learn this, they've got it for me, that is not a cause. It may be something that you observe, but it's not causing the delay. Also unlikely to be the cause, and I cannot say this loudly enough or often enough, having a child who's exposed to multiple languages. This is not going to cause a speech and language delay. And I've heard this concern from families who have, have multiple languages in the home. Maybe one parent is bilingual and one parent is not. Maybe both parents are bilingual, but grandma is not. And I have families ask whether they need to stop speaking to the child in grandma's first language. Typically around this area, it's usually Spanish speaking families and kids. And no, children are very capable of learning multiple languages at once. Now, they may go through what we call quiet periods. They may go through some where you'll hear a couple words in one language and they pop a word in from another language as their little brains are sorting out vocabulary. But having a child exposed to multiple languages is not going to cause a speech and language delay. In fact, that is actually one of the criteria for a speech and language delay, is if the child is communicated with in multiple languages, are we seeing the same delay in every language? And if we are, then it's a true speech and language delay. And if you're only seeing the delay if a child's being exposed to both English and Spanish and they're only speaking in English, that is not a language delay. That's just a child who, for whatever reason, maybe they're hearing more English. TV shows are in English, they're hearing more English, so that's the language that they're picking up first, but that doesn't mean that you stop exposing them to the other language. Also unlikely to be the cause of speech and language delays, I have to be careful with this one, is screen time. Now, the American Academy of Pediatrics has their recommendations for screen time, and they're pretty stringent. I'm sure everyone has seen those by now, that like no screens at all under the age of, I don't remember, 18 months or something, and then only FaceTime. And they're pretty unrealistic in today's world. I'm not going to lie. Now, I'm not saying that it's a great idea to hand a 2-year-old a tablet and let them walk around with a tablet all the time. But actually, what I see more that is concerning to me more than the child's screen time is the parent's screen time. That can be problematic. Children learn language from the adults around them. They don't learn language from their toys. They don't learn language from Miss Rachel. They might learn some fun finger plays and do some nice imitation from Miss Rachel, but they're not going to learn actual communication skills from Miss Rachel or any other educational show. Yes, you can learn your letters from Sesame Street and stuff, but I'm saying I'm looking at communication. I want a child who communicates, not one who learns all of their colors by the time they're 2. I want a child who can tell me when they need a drink or when they hurt. And so I do always recommend that any adults who spend a lot of time with kids are cognizant of their own screen time, because the children that are in your care need you to talk to them so that they can learn about the things around them. And it's really hard for me sometimes, and especially very young children often don't use words to communicate. They do that joint attention. They look at you. And if you're not attending to them, if you're buried in your own phone and scrolling on TikTok, and your baby is trying to get your attention, but they're not doing it vocally, they're just doing it with an eye gaze and trying to coordinate that gaze with you, they're missing learning opportunities and you're missing connection opportunities. So I would just, I'm never going to lecture people on screen time. Parenting is very hard. Taking care of young children is very, very, very hard. So I don't give lectures ever. I just always recommend just being cognizant of what is happening around you when you're on your screens and what is happening with your child when they're on their screens, and then taking an honest look at whether that's an area of potential concern. Us also unlikely to be the cause of delays is staying home with a caregiver or attending daycare. And I've heard both. Oh, I think she's delayed because she stays home with mom and she's never around other kids. Or I think she's delayed because she goes to daycare and isn't getting that one-on-one adult time. No, that's not causing delays at all in either case. Kids can learn language and thrive in a variety of environments. Children are incredibly resilient and they're little sponges and they're ready to pick up those skills. So again, like no guilt if you're staying home with your child and they don't go to play groups and daycare and stuff. That's great. They can learn from you. If you work full time and your child goes to daycare, that also is not why your child has a delay. So, no guilt. We're not doing the guilt thing. We're just trying to help and support kids. Also, last thing, unlikely to be the cause is anything that was done or not done during pregnancy. Now, I do have to caveat, obviously, exposure to certain substances that can be definitely a factor in developmental delays, including speech and language delays. But what I mean is, oh, I was too active. I ran too much. I didn't exercise enough. I drank caffeine. I ate soft cheese. All of those things. None of that is what caused your child to have a speech and language delay. So we're going to let that go. Okay, so Illinois' early intervention program, the way that early intervention works in Illinois is the state is divided up into what are called CFCs, Child and Family Connections. And our Child and Family Connections is CFC 14, covers Peoria, Tazewell, Woodford, Stark, and Henry counties. Now, anyone can refer a child for evaluation, and this is really important information. You do not need a physician referral to refer a child in Illinois for a developmental evaluation. you can get a physician referral, but you don't need one. Anyone can call. A parent can call, a foster parent can call, a daycare provider can call, a grandparent, an aunt, an uncle, a friend, anyone can call. The one thing I will recommend is that if you are going to call the CFC and refer a child for an evaluation, a child that is not your child, I would strongly recommend that you have a conversation with the parent first. Like you have that conversation. And all of the milestones that I listed were on it's ASHA.org, the American Speech Language Hearing Association. The CDC also has milestone lists. So like if you want something to say, I'm a little concerned about my little grandbaby who's not doing X, Y, and Z, hey, I know about this great program. I would definitely discourage anybody from calling and having someone surprised that their child was referred for an evaluation. That's all. It's not a nice surprise. You can refer any child between newly from birth. My own children entered early intervention directly out of the NICU. They went straight from NICU into early intervention at the age of 4 months. Up to 36 months old, children do age out on their third birthday. With the exception the last couple of years, kids with summer birthdays can qualify for extended services. So like if a child turns 3 in June, they can get services through the summer as long as they qualified for services with the school district. And we'll talk a little bit about that later. There is no cost at all for the initial evaluation. And that is also very important to note, that it costs not a dime to have experts come, and experts in early childhood development come and take a look at a kiddo that you have concerns about. And actually at this moment, there is no cost for anything within the early intervention system for anyone. Prior to COVID, there was a family fee that was on a sliding scale, I think ranged from no cost at all up to, I think, $200 a month, but it was only the highest earners that $200 a month. Anyone who is on Medicaid, there's no cost. So, but at this time, they got rid of family fees during COVID, and they have not yet brought them back. That could change at any time. This is Illinois. But at this moment, there is no cost at all, no out-of-pocket cost for any service within early intervention. So I don't want that ever to be anything that stands in anybody's way. Here's the contact information for our local CFC 14. You can Google it too. If you just Google, early intervention Illinois, you'll eventually find your way to this information. The initial evaluation is to determine eligibility, and there are several ways that a child can be determined to be eligible for early intervention services. The most common one is a 30% or greater delay in one or more areas of development. Go over those areas in just a minute. The clinical judgment of the evaluators is another way a child can become eligible. So what I see happen an awful lot is I'll be doing an initial evaluation, and the test comes out and tells me that this child has a 28% delay in their language skills. And I say, yeah, it's not 30%, but I have concerns. So I can use my clinical judgment to make a child eligible for the program, even if their test scores say that they're not eligible for the program. If a child has a medical condition that typically causes developmental delay, they're automatically eligible. So kids with cerebral palsy, kids with Down syndrome, there's a whole long list of diagnoses. Those kids are automatically eligible for early intervention. Kids who are determined to be at risk for developmental delay, and again, there's a list of criteria. It includes things like if the birth mother is very, very young, or if either of the parents themselves had developmental delays or have developmental delays. There are a list of criteria for children who are considered to be at very high risk for developmental delays. They're automatically eligible. And then any child in DCFS care is automatically eligible for the early intervention program. That does not mean they will automatically get services, but they are automatically eligible for the program, at least of this moment. That is another thing that kind of keeps changing, is that eligibility of kids who are in DCFS care. The initial evaluation is always completed for all children who are referred to the program, even if they have automatic eligibility, we still do that initial evaluation to get a full picture of the child and their abilities. There are always at least two therapists present for the initial evaluation. There will always be what is called a developmental therapist. And in Illinois, a developmental therapist is essentially a teacher, an educator who specializes in the development of very young children. And then at least one other therapist. So if the main concern of the person who referred the child, if their main concern is gross motor, then it'll be a developmental therapist and a physical therapist. If their main concern is speech and language, it'll be a developmental therapist and a speech therapist. Sometimes there are multiple concerns, and we'll have a developmental therapist and a speech therapist and a physical therapist all there for that initial evaluation. The different areas of development that are assessed at that initial evaluation, we look at social emotional skills. So how is a child developing socially, emotionally, or how are they interacting with people around them? How are their adaptive or self-help skills? Can they drink from a cup? Can they use utensils? Do they let you know when they need a diaper change? Things like that, depending on the age. It's all done, through an age appropriate lens. We look at social emotional, adaptive, communication skills, motor skills, and then cognitive skills. Like, what do their early play skills look like? If I show a child a ball and I throw a blanket over it, do they know to look under the blanket to find the ball? Things like that. That initial evaluation is very play based. So it's very child centered. All of the evaluators in early intervention, we have a lot of experience working with these young children. We usually have a lot of questions for the caregivers. We are prepared for kids who are extremely shy and aren't going to show off their skills. We are prepared for kids who are going to get upset at strangers in the home. We are prepared for kids who are very, very active. It's just fine. We have all kinds of creative ways of getting the information that we need at that initial evaluation. Now, if a child is eligible for services, the team consists of the child's caregivers, and the team can include parents, can include foster parents, can include daycare providers, can include anybody who, if grandma watches a child during the day, grandma might be on the team. Anybody that is regularly in the child's life can be part of the team. The service coordinator, when you enter early intervention, every family is assigned a service coordinator who makes sure that all the paperwork gets signed and helps coordinate services, helps with areas of support outside of therapy services. And then the evaluating therapists create this individualized family service plan. The outcomes are always developed based on the family's concerns. So we always ask our families, like, what is it that you want to see your child doing? And then we kind of help massage the wording a little bit. The services are determined by the team as a whole, and that includes both the therapists and the family, the caregivers. Services are never forced on anyone. It's very family centered. Sometimes we recommend lots of services and a family says, oh, whoa, that is too much. I don't have time in my schedule for that much therapy. So we'll change it based on what works for the family, what works for the child. Services in early intervention, and including this initial evaluation, can happen in the home. They can happen at daycare, whether that's an in-home daycare or a daycare center. They can happen in another community setting at the library or at the park or at McDonald's Playland or wherever. Or they can be given online via live video visits. Sometimes that's a great option for families who live in underserved areas because of the fact that we providers go into homes and go into community settings. There are some areas that have fewer providers than other areas. So live video visit can be a great option for families who maybe will sit on a waiting list for a while. Okay, so I get the question a lot, what in the world does speech therapy look like in early intervention? Because what I'm really not doing is I'm never sitting down with a stack of flashcards and asking a kid to repeat words after me. Now, every therapist is different. I do what I call, well, not what I call, it's called bagless therapy. So when I go into a home or into a daycare, I insert myself into whatever is going on in the home or in the daycare center at that time. I do not bring a bag of toys 99% of the time. 1% of the time I do, but for very specific reasons. But typically, I don't bring a bag of toys in. We use whatever the family has in the home. Some families do not have a lot of toys, and that is okay because play does not require toys. We can play all the time. We can play with people, and we can play with toilet paper tubes, and we can play with pots and pans and wooden spoons. Like, we don't need toys. Um, that's how I do therapy. I tend to like to teach strategies using what families have in their homes. Some therapists prefer to bring in a bag of toys to target specific skills. It kind of depends on what the child's needs are and how the therapist wants to help that family meet their goals. Um, Speech therapy and really all early intervention therapies are very child and family centered. We are not trying to impress, like, I'm not trying to teach your child words that I think are important for them to learn. I want your child to learn to communicate in a way that's meaningful for them and meaningful for your family. So, like, if one of your biggest goals is, I really want him to say hi to grandma because it just breaks her heart when he doesn't ever say hi to grandma, then we're going to work a lot on practicing saying hi to our toys and hi to our dog and hi to everybody around us. Because if that's an important goal for the family, that's a goal they're going to be likely to work on. We like to, as much as possible, teach strategies. So I've said many times, speech therapy is not brain surgery, meaning that like, to be a surgeon, you have to be able to do some very specific skills that not everyone can do. For speech therapy, I have some specialized knowledge. I have some specialized experience in speech and language development and working with young children. But when it comes to the actual strategies that I use, there's nothing that I do in a speech therapy session that I can't teach a parent or other caregiver to do as well. And I realized early in my career that when families would their child would start doing something and they'd be like, "Oh, you're so magical." And I'm like, no, that wasn't me. Your toddler isn't learning what I'm doing with them for 1 hour every week or every 2 weeks. Your toddler is learning from you. And I realized early on that when families incorporate the strategies that we use into their daily routines, into mealtime and bath time and diaper change time and getting in and out of the car and all the things we do multiple times a day, that's where the real power comes in, and you can really start to see some changes. Speech therapy and early intervention is very play-based. There's no drill. There are no flashcards unless a kid's favorite thing is flashcards. Every once in a while, I run into a child who, like, literally their favorite thing is like their little stack of flashcards, and then fine, we play with flashcards. But it's very play-based and very centered on what is powerful for the child, because we all know toddlers are we can't make them be interested in the things that we want them to be interested in. They're going to be interested in what they're interested in. So our best bang for our buck is to follow their interests and help them in the context of what they already love to do. So in that way, it's very much not like speech therapy in a school. I'm not sitting at a table with your child. I'm sitting on the floor. All my work clothes are very comfortable because I am on floors a lot. And sometimes we're crawling around and rolling around and pretending to sleep on the stairs and playing peekaboo under blankets. And we do all kinds of stuff, but it definitely does not look like the speech therapy you ever had in school. Very often in this age group, I'm actually targeting pre-communication skills, or what I call foundational skills, more than actual talking, because much of the time what I find in that initial visits with a kiddo is that they aren't really ready to start talking. So those foundational skills, and these are the skills that every child needs to have all of these pretty strongly in place before they're really going to start talking a whole lot. You might see some words, but that big language explosion isn't going to happen until we start seeing really all of these. Reacting to events in the environment. If a kiddo does not notice when people walk into the room, or they don't notice when a dog starts barking, they're definitely not ready to start talking yet. Responding to people when they talk, turning to the sound to somebody talking. Taking turns. And in young children, taking turns doesn't mean like taking turns in a board game. It means like making sounds back and forth, rolling a ball back and forth. I shake a rattle, then you shake a rattle, and we go back and forth. That's turn taking in young children. Developing that longer attention span. And that goes back to those little people who are super motor driven. their attention span is short for now, and we need to have that longer attention span. Again, not before we're going to see some words, but before we're going to really start seeing that big blossoming of speech and language. Shifting and sharing that joint attention, just one of those very, very important skills. Playing with a variety of toys in a variety of ways. Understanding early words and following simple directions, like we talked about earlier. Vocalizing and making sounds purposefully. If a child is not yet really vocalizing, they're definitely not likely to pop out with real words before they start making some of those vocalizations. Imitating actions, gestures, sounds, words. That is very often where I end up having to start with my little early intervention friends. It turns what a lot of them have is they struggle to imitate. And one of the earliest things you'll see is when you do like finger plays with child, so the wheels on the bus go round and round, or you do like the itsy bitsy spider, and you see kids trying to imitate. Some kids don't. They don't imitate those actions. And just like earlier, I said if we're struggling with our motor skills, we're going to struggle with our speech skills. If we have trouble imitating wheels on the bus, doing this with my hands, I'm definitely going to have an even harder time imitating sounds with my mouth because that's harder. So we often really target those early, do a lot of finger plays and a lot of silly gestures and pairing gestures with a lot of and I don't know, and big gestures and big, verbal routines and stuff to encourage that imitation. Using those early gestures are really important. There's a project called 16 by 16 months. It's 16 gestures by 16 months. And it's things like waving and pointing and thumbs up and fist bump and high five and shrugging. And all of that gestural communication is important stuff. And then initiating interaction. Again, a kiddo's not ready to talk if they're not using their body to initiate communicating with the people around them. And with that is all I have. I had gotten a question. Would you like me to address that question that you emailed to me, or did you want to shut off the recording first? I don't.
Yeah, let's go ahead and turn off the recording and then
Right.
we'll do the question that you had to begin with. And then
Yes.
if anybody else has questions, they can pop into. All right, I'm going to stop that.